All right, so in the space of 2 months, now this is October to November 2019, the Gauteng Department of Health has managed to save an estimated 10 million rand through mediation, this excluding the possible legal costs and costs of acquiring medical experts that could have been incurred through litigation in cases brought against the department. Well, if these cases were not mediated, the department says the mediation process has proven to be one of the most successful factors in reducing cases of medical negligence and by large reducing the contingent liability this far. Let's chat now to the Gauteng MEC for Health, Dr. Bandile Masuku. Very good evening to you, MEC. Are you on the line with us?
Yes, and good evening, and thanks for having us, and good evening to your viewers.
Thank you very much, MEC. MEC, first, let's talk about these mediation efforts in cases brought against the health department and how that has managed to save you money.
It has been a strategy that has been adopted also by our cabinet, last year, because we felt that, it becomes a bit dragging when you get to court, and it's also very costly. And we developed the framework of mediation, which helps us to resolve all the cases quicker, and it allows the complainants to have closure very quick. And it has proven now that with the 13 cases that we have actually mediated, the 6 that we've completed has shown that we could save a lot of money from that.
Yes, but I want to talk about whether you as a department are addressing the actual root cause of why there continues to be, for example, gross incidents of negligence that are being brought against the department.
Yes, it's a two-pronged actually strategy, because we cannot only deal with the outcomes of everything in terms of mediation. Yeah. We also have to deal with the root cause and also try and get to the issues that relate to the shortage of staff, the shortage of equipment, and also just the shortage of time in theatre. So this is a two-pronged strategy, and one way is that we are, attacking, the vacancy rate that is happening in our province. And in our facilities, and we are also looking forward in making sure that what we learn from mediation helps us to also educate and retrain our staff members.
Yeah, I'm certainly not downplaying the mediation efforts, MEC, but I would sort of liken it to putting a plaster over a festering sore. I'm sure you would agree with me that this should not be happening in the first place.
Yes, that's why I'm saying to you that it's a two-pronged actual strategy.
Yeah.
Whilst we deal with the issues of mediation, those outcomes that have been addressed, we also address the root cause. Because in medicine and in health, it's important for us to understand the root causes so that we can be able to retrain and re-educate our health workers. Because in essence is that we also need to make sure that we change even the knowledge systems that are already available in some cases. Remember that there are other incidences that help us to understand other disease processes and other issues that we are actually facing.
It's a lot of money, certainly, MEC, that you've managed to save. 10 million rand, of course, being a lot that could have potentially gone down the drain. That's possibly money that could have been used to deal with the staff shortages that you speak of and, massive infrastructure problems. I'd refer to a recent incident at Helen Joseph Hospital, for example, where there was flooding recently due to heavy rains. That 10 million rand which was saved, which would have otherwise gone down the drain, could certainly be used to address some of the challenges that you are facing within some of the hospitals within Gauteng.
That's definitely our attitude, but it also says that we need to make sure that we audit the cases that are already there on the case roll.
Yeah.
And we have with the progress that we have made, besides the 10 million that we have saved on mediation, we are also bringing down the cases that are on the court roll and also bringing down the cost on the litigation bill that has been there. The latest that we have found that we have actually went down 2 billion from what it was in 22 billion, last year. And this is just also one of the processes that we have put into place to make sure that we reduce the cost, because they actually have a detrimental effect on the budget of the department.
And certainly others might say that perhaps, a lot more work still needs to be done. I'm sure you're working around the clock to address some of those. But what would you say to critics, for example, when we talk about, the NHI and, whether we were even ready when seemingly others would argue we can't seem to get the basics right. I know there are many challenges that, your department is facing at the moment. You're trying to get the hospitals up and running to a certain degree. But of course, some would say, there we are talking about the NHI, but we can't seem to get the basics right.
Yeah, I think the issue about NHI is that essentially it will help us to resolve some of the crises. But some of the things that we need to do in terms of the challenges, in a way that we are running our healthcare system, in the way that we do our health and how we live our lives as South Africans, even if we can get a lot of money and a lot of, maybe let's say $1 trillion, we won't be able to deal with the challenges and the burden that we face. So some of the burden that we have, actually, most of them are preventable. Yeah. And if we change, it just wants us to change how we rethink, how we run our lives, how we do our things, like the issues of sugar being easily available, the issues of alcohol being easily available, because trauma becomes one of our bigger challenges. So NHI on its own will help us to bring enough resources, but it also forces us and compels us to change how we live our lives and how we conduct ourselves going forward. So for us is that the NHI is important. Most of the countries who introduced NHI were not at any point having a flourishing economies, or their hospitals were actually very good. Most of them, they started their NHI or their universal health coverage whilst the economy was actually at its lowest. Japan, Britain, and others, they all started their economy when NHI, when the economies were at their lowest. So it also indicates that the investment that we put on health will also help us to turn around the economy on its own in terms of productivity.
The MEC for Health here in Gauteng, Dr. Bandile Masuku, thank you very much indeed for your time this evening.